Welcome back. In this video, we'll talk about cholesteatoma. This video is sponsored by UN Academy. Unlike the name suggests, this has nothing to do with cholesterol or tumors. It refers to overgrowth of some dead debris and dead cells within the middle ear. This desquamatized mass usually corrodes the ossicles and lies over the drums. They can be congenital, primary acquired, or secondary acquired. Congenital when they're there since childbirth, primary if they have no other cause secondary such as an infection or hemorrhage, and secondary is the result of, infection or hemorrhage. If it's chronic and it goes untreated, it can result in some negative pressure within the middle ear, and over time this can erode the ossicles and result in conductive hearing loss. The most common complaint is painless otorrhea. UN Academy is the largest Indian teaching platform. They have a variety of interesting topics and courses, and recently they have extended their courses to include topics for the USMLE and the Step 1 exam. The USMLE course checks all the important marks, including recognized names like Dr. Najib and Dr. Raj, and of course many other skilled teachers. It has more than 800 recorded lectures and comprehensive videos. Unlike all good courses, they also have their own Q bank with more than 3,000 questions and 300 review videos. For a limited time only, the course will have 75% discount with an additional 10% discount if you use my coupon AHMAD10. Once you purchase the course once, you will have free access for a full year. Not to be confused with cholesterol granulomas, which are the result of secondary causes, most likely hemorrhage, and they're far less common. These appear more blackish or bluish, unlike cholesteatomas, which appear more yellow-whitish. And here's a small quiz. And here is the answer. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helped.